Now, there's one topic that worries parents the world over. It used to be only alcohol, drugs, wagging school that people who had kids had to worry about. Now there's a whole minefield around gender transitioning, and whether parents have any say at all in what medical procedures their kids undergo, even at a young age. We've read the stories. The helpless parents as their child transitions with support from school teachers or doctors. And if a parent doesn't go along for the ride or dares to disagree, they're labelled homophobic and heartless. This has been a movement globally, particularly in the United States. But senior doctors at one of Australia's leading children's hospitals are questioning this. They're questioning the gender-affirming approach in medicine. They say there's sparse evidence to justify the use of puberty blockers. Senior physicians at the New South Wales Children's Hospital Westmead's Gender Clinic have studied the physical and mental health of 79 patients in a rare academic study looking at the outcomes of children who presented with gender distress and gender dysphoria. Their study, and it was reported in the Australian newspaper, found that 88% of children presenting at Westmead's Gender Clinic had at least one comorbid mental health condition, with more than 50% diagnosed with behavioural disorders or autism. They said that 1 in 5 children who consulted with the clinic with gender-related distress later had those feelings resolved, and they say that almost 1 in 10 with a formal diagnosis of gender dysphoria had taken some puberty blockers and cross-sex hormones, later discontinued transitioning. Now, the journalist who has been looking at this issue joins me now, health editor Natasha Robinson. Natasha, thanks for your time. Why is Australia continuing to progress, particularly the New South Wales government, which you've looked at? Why are they continuing to progress with this gender-affirming strategy when physicians at Westmead Children's Hospital have expressed their concerns with it?
Yeah, well, I think the situation is there is no consensus on this issue in the medical community. There's a very active debate over these issues, and there is a real Sydney-Melbourne divide. These clinicians that you just referred to, Sherri, highlighting that story, are from the Westmead Children's Hospital. They have a gender clinic there, but it only, it doesn't see all that many patients, only operates, I think it's like 1 day a week. Whereas the clinic in Melbourne, the major gender clinic at the Children's Hospital in Melbourne, which is really the centre that has been associated with the kind of, push and wide acceptance of the gender-affirming approach in Australia. They see a lot more patients, and they are very much at the other end of the spectrum, if you like, to those doctors at Westmead. So the doctors at Westmead sort of they had a real sort of dig, I think it's fair to say, at the so-called standards of care in this area, which were developed by clinicians at the Children's Hospital in Melbourne. They say that they're not sort of recognised as standards.
So just talk us through what the findings were from the physicians and the doctors at Westmead Children's Hospital who did this study looking at the 79, I think it was, patients that they've seen. What were their main concerns?
Yeah, I guess their main concerns were the findings really challenged very much the kind of main bases of gender-affirming medicine. And that is, one of the main reasons for progressing children, down this kind of medical path in terms of giving puberty blockers and then cross-sex hormones after the age of 16, was that it alleviates their mental distress. And they found, based on the outcomes of children who did go down that medical path, that it actually wasn't borne out in evidence that the mental distress was actually alleviated. It was very, very high numbers. I think it was like 44 out of 50 of them still experienced really significant mental distress. So that kind of claim that, this is the, unless you sort of, progress down this path, people's mental health is at risk, really was not borne out, because their mental health was still relatively, very poor, even after this kind of treatment. So that was one issue. There were other, kind of claims, said to form the basis of evidence around gender-affirming medicine that they also challenged, and And that really related, I guess they're really, really concerned that, such high numbers of these children are neurodiverse and they're experiencing significant confusion, mental health, comorbid conditions, and they felt very strongly that there needs to be what they called a much more nuanced approach taken to these issues rather than just saying, well, that's all because of the gender confusion.
Yeah. Okay, and it's something that often doctors don't speak about. We only hear the other side of the issue, of the story. Natasha Robinson, health editor at the Australian newspaper, thank you very much for joining us.